For Dan, the risks are greater and lockdown was longer.
Dan was in the house for 101 days, not that we were counting.
COVID-19 meant less support, right at the time when life got harder.
There's just a massive chasm between our lived experience and the experience of those who aren't petrified of what COVID could do to them or their family members.
In March, fearing lockdown was imminent, Sarah moved in to help her parents with Dan's care. Their younger brother Sam had the same rare genetic condition as their older brother. He died last year, suddenly and unexpectedly, from sepsis and pneumonia.
I've been out in my car and cried and tried to find a side street to cry on. Obviously, as a family, we're still grieving the loss of Sam, which has left a huge hole in our lives. We try and stay positive for all of us because, if any of the four of us are having a particularly bad day, it knocks on to the rest of us.
Do you feel like the rights and the needs of people with learning disabilities haven't been prioritised enough in all of this?
I think that is the case in general, unfortunately, with or without the COVID pandemic.
Figures published last week by Public Health England give some evidence to what many, like Sarah and her family, have known all along about the unequal impact. Young adults with learning disabilities are around 30 times more likely to die with COVID-19 than other people the same age. Across all ages, the risk is around 6 times higher.
We're looking at the same kind of social and economic things which drive health inequalities across the board. So we're talking about poverty, hardship, social isolation, unemployment. People with learning disabilities are more likely to be experiencing those things throughout their lives, and that puts people at risk. And then COVID comes along like a truck and hits that group of people harder.
Professor Chris Hatton is trying to recruit 1,500 people with learning disabilities from across the UK. He's part of a project by Warwick and Manchester Metropolitan Universities, which will spend the next year talking to the volunteers and their families.
So people on the whole that we've spoken to are having a rough time, and people sometimes feel abandoned and forgotten. But then having said that, there are other aspects of people's lives. So many more people with learning disabilities have got online and they're using Zoom and they're using WhatsApp and they're getting together virtually in ways that they didn't before.
That's what Sapphire's doing with online discos and support sessions to help others with learning disabilities. She told me social distancing and each new change of rules were hard to understand at first.
Doing all this stuff, I thought to help others because my mental health, I thought it would help my mental health and other people in different mental health out there. And people loved it and they said that I was a legend.
And that's the point. With the right support and more understanding, perhaps the months ahead might not be as hard for as many.
Claire Fallon reporting. Well, the Department of Health and Social Care told us they're aware of the impact the COVID-19 pandemic has had on people with a learning disability and said the Adult Social Care Winter Plan sets out actions to protect everyone in the care system from COVID-19, including testing for staff and residents in care homes and supported living settings in high-risk areas.